So over the last 24 hours, we had 5 new cases, and we are monitoring 66 persons who are positive for COVID across the country. Of these 66 persons, 2 of them are in the hospital, so we'll monitor them. Nobody right now is in the ICU, and that I think is a really good thing. So on average, we do about 230, 250, 250 doses per day. Right now, for adult vaccination total, first dose, we have administered 447,198 doses. That's equivalent to 87.2% of the adult population. Second dose, we have administered 347,088 doses. That's about 67.7% of the adult population. In terms of persons 12 to 17, we have administered 35,819 first doses. That's 49.1% of that age cohort. And second dose right now, we have administered 26,308 doses, or 36.1%. For the persons between ages 5 and 11, we have administered 8,763 doses. That's about 8.6% of that age cohort. And second dose is now 4,727 doses, or 4.6% of that age cohort. Boosters, there are some people who would have taken their first boosters, and then there are persons who came back for their second boosters. But boosters overall, we have administered 74,620 doses. Now, there are a couple of things here. I think what is important, we need people to come. Those who are older, persons who have other illnesses, they should come and make sure that they get their booster shots. I think that's very important to prevent them from getting hospitalized. And the second thing is that we do have a lot of pediatric doses, and we know that the children, they're back at school, so one way of helping those children to fight off any COVID infection would be to make sure that they get their vaccinations. So these doses are available. So right now we have Pfizer, we have Moderna, we have Sinopharm, and we have a limited amount of J&J vaccines. So any one of these vaccines, people would like to get their booster shots, or they would like to come because they're in that age category, let's say 5 to 11 or 12 to 18, then they can come and get the vaccines. Well, the Clinton Health Access Initiative is one of many partners that we have. They came in to work with us during COVID, and so over the life of this project, which comes to an end this year, they have been able to help us in several areas of the COVID response. So the first one being helping us to get some testing kits, and they have provided us with 5,000 rapid kits. They have been working with us to strengthen our laboratory capacity. So we have had some trainings with them online. And next week, they are going to do an in-person training for laboratory staff in terms of quality management. This week, the training that you referred to, which happened yesterday, we have been training, we have identified persons who have worked in our ICUs. So this is not just at the Ocean View Hospital, but across the country. And we brought them out, and they received training in ICU management. So the Clinton Foundation brought in ICU specialists, and they spent most of the day going through the basics in terms of ICU management of a COVID-19 patients. Now, the disease would have evolved, but the techniques and what you need to do, how to master the various equipment that you'll have in an ICU room would still be pertinent. So the training that they receive, while it's in some ways is specific to COVID-19, that training can also work for any critically ill patient. And so I think it's going to be beneficial for everybody who participated in the training. And what we have tried to do is not just bring doctors, but we brought teams of people. So the team that is working in a particular ICU, so you have doctors, nurses, pharmacists, and so forth, as part of this response team. So yesterday the training started. It's going to continue today. And hopefully by the end of the exercise, we'll have people who are more knowledgeable in terms of ICU care of patients. We have been working with UNICEF to be able to procure Paxlovid. So that's something that is still on the cards. And with Paxlovid, if people test positive for COVID-19, we'll be able to treat them. And this is oral treatment. You drink the tablets for 5 days, and you should be well after taking the complete treatment. So we are working on these things, and Paxlovid has been very difficult to source, and it's a very costly medication. But through this initiative with UNICEF globally, we are going to get it at a very discounted price, and we have made an order for these medications.
Any ideas to how soon?
Well, I'm hoping that we can get it maybe within a month, so that persons would be able to get the benefit of Paxlovid.